Good afternoon. Great to see you all here. This is a really exciting topic, so I hope you enjoy it. We're just going to look a little bit about the history of psychedelics on this planet and then move forward to what's happening now in a therapeutic setting in the research world. It's a very big overview. It's a huge topic, so we're just going to be touching on it. So, psychoactive substances occur in abundance in the natural world, and they've been used by humankind for millennia, with evidence of ceremonial use found in various cultures around the world. Does anyone know where these stones are from, these carved pieces? They're, sorry? Yes. Yep, from the Aztec civilization. Yeah. So there's been cave art and stones that have been found that are thousands of years old in various countries around the world. So there's a mural that's in the Selva Pasculia cave in Spain, and this has been dated to around 6,000 to 6,200 BCE. So scientists believe, many people believe that these are mushrooms, that they're psilocybe hispanica mushrooms. And there's a lot of debate whether they were actually using psychedelic mushrooms at this stage. And obviously, it's so far in our past, we don't know for sure. But what we do know, for them to take the effort to carve them into the rocks, we know that it was very important in their culture. So they had a very prominent place in their culture. Peyote. So many Native American tribes consider peyote a sacrament and a gateway to the spiritual realm. Its ceremonial use is deeply rooted in tribal traditions and serves as a means of maintaining cultural identity, transmitting traditional knowledge, and strengthening community bonds. So there were two archaeological specimens of peyote buttons collected from a cave in Texas, and these were radiocarbon dated and undertook alkaloid analysis, and it suggested that the ceremonial use of peyote occurred in these cultures around 5,700 to 5,000 years ago. So here we have Soma. We're looking in the Indian culture now. And the Veda, which is one of the four Vedas in Hindu philosophy, describes the use of a plant-based intoxicant called Soma, which was used widely in rituals and ceremonies. And this is mentioned many times in the Veda. It's not just a one-off. Although its exact composition is unknown, some scholars propose that the soma might be related to the Amanita muscaria mushroom. And the reason they believe this is because the mountainous origin, which is described in the Vedas of the soma, is the same as the habitat of where these mushrooms grow. And also, the texts reference filtering mechanisms of soma, and this also matches the preparation of the mushroom. So, in Central America, around 1300 to 1500 AD, the Aztecs consumed a mushroom referred to as the flesh of the gods for spiritual purposes, therapeutic, and ritual. So these mushrooms were used in religious ceremonies to facilitate communication with the gods. They were consumed in festivals and rituals, and they were often mixed with honey or cacao or chocolate just to make it taste good. And the Aztecs believed that the mushrooms allowed them to access higher states of consciousness, gaining insight into the workings of the universe and understanding God. And in Greece, in ancient Greece, an example of psychedelics are found in the Eleusinian mystery rites. This is one of the largest mystery schools that we've had in recorded history that we know of. It was a ritual. It was a 10-day festival held in the summer of every year, and people would come from far and wide to participate in this ritual. There was some fasting involved, some dancing, some fasting and a long walk, and then they drank the sacred drink, which is kaikion. And we believe that that was made from barley and pennyroyal. The ritual was dedicated to Demeter and her daughter, Persephone, and it celebrated the harvest, fertility of the land, and the universal cycle of life, death, and rebirth. The consumption of kaikion played a crucial role in the ceremony, allowing initiates to access profound spiritual states and connect with the divine. Following the discovery of fragments of ergot in the temple dedicated to these Eleusinian goddesses, scholars propose that kaikion may have contained ergot, and thus it's having the same properties as LSD. So that's just a little bit of the history, the ancient history that we have recorded. Now we'll have a little look of traditional use of psychedelic plants. So let's have a look at how it's used today. So looking at shamanic cultures, so in many indigenous cultures, psychoactive plant medicines like ayahuasca and peyote and psilocybin containing mushrooms are used by shamans to access non-ordinary states of consciousness, to communicate with the spirits and their ancestors, access realms of spiritual guidance, and assist in diagnosing mental and physical disease. And we'll have a look at a few of the different cultures. So the indigenous people of the Upper Amazon region have used ayahuasca for millennia. Ayahuasca plays an integral role in initiation rites. It's used to facilitate spiritual growth and self-discovery, as well as in traditional medicine and spiritual practices to treat mental and physical disease. Typically, ayahuasca produces very powerful visions, alterations in all perceptual modes, as well as profound personal and spiritual insights and mystical experiences. Shamans believe that ayahuasca allows them to access other realities, communicate with the spirits of the forest, access ancient knowledge and wisdom, and ultimate truths of the universe, as well as encounters with the divine. And looking at peyote now, the Native American Peyote Church. So this church was founded in 1885, and it's a fusion of traditional Native American beliefs and Christianity, and it uses peyote as a sacrament in religious ceremonies. So the members believe that the peyote is sacred and holy medicine given to them by God and helps them connect with the divine, helps them to access spiritual guidance and achieve spiritual growth and transformation. And psilocybin. Psilocybin is a natural compound occurring in certain mushroom species, and it's been used for centuries in indigenous cultures in Colombia, Mexico, and Guatemala for spiritual, medicinal, and ceremonial purposes. The Mazatec people in Mexico have used psilocybin-containing mushrooms in ceremonies led by curanderos, their healers, to promote healing, spiritual growth, and connection with the divine. The Yanomami people from the Amazon basin have also used psilocybin-containing mushrooms in their traditional ceremonies involving music and dancing to promote spiritual growth and healing and foster greater connection with the community and with the natural world. And ibogaine is a psychoactive compound extracted by the tea iboga plant found in Central Africa. And this has been used for centuries in Bwiti traditional rituals for spiritual growth, community harmony, physical healing, connection to nature, and communication with the spirits and ancestors. In Bwiti religious ceremonies, the root bark is pulverized and swallowed in large amounts to produce intensive psychoactive effects. In Gabon, tea iboga is viewed as a sacred medicine, a master plant, and in the year 2000, in recognition of its cultural and spiritual significance, was declared a national treasure. Ibogaine is used in initiation rituals where young Gabonese women and men attend ceremony in separate huts for the first time as a rite of passage for spiritual growth and to help them to integrate into the adult community of their culture or their tribe, and also to integrate into the spiritual community. So it's not only humans that have ingested psychoactive plants. So many animals, from insects to other animals, have also partaken in ingesting these plants over and beyond what that they need to eat just for their everyday survival. For example, the reindeer that we see here from Siberia are frequently witnessed drinking the urine of animals that have eaten mushrooms, and these are well known from the local shamans to be excreted as active psychoactive compounds. So what we can see from this traditional use, there are a number of things. First of all, that these psychoactive plants are used in ritual and ceremonies. They're very revered in their tribal culture. They have a lot of respect for the medicine and the experience. A lot of these cultures believe that the healing takes place through the medicine. Historically, it was more so maybe the shamans that would take the medicine, and the shamans would get the guidance through the spirit in the medicine to do the healing. But recently, lots of the people, it's not just the shamans now, it seems that there's been a change in the trend, and now a lot of the people are also taking other substances with the shaman as well. Of course, there's access to non-ordinary states of consciousness. It's not just this state that we inhabit. We have other states, higher and lower, which we can access for healing. There's a big, they get spiritual guidance from these plant medicines, and they do provide the healing and the therapy. So if we look at this medicine today, I think we can say in the broadest sense of the term that psychedelic therapy dates from this prehistoric knowledge of psychoactive plants, with elements of psychotherapeutic practice recognized in these shamanic cultures across the globe. And in fact, in the 1950s, when there was a lot of taking of LSD, I think there was a lot of people were incorporating these rituals in that ingestion, when they were taking it to keep themselves safe. So if we look at the early scientific inquiry of the psychoactive substances in the West, so we first of all have in 1897, the German chemist Arthur Hepter first isolated mescaline, which is the primary psychoactive compound in the peyote cactus. And in 1943, we have Albert Hofmann. He first discovered LSD in 1938, but he didn't really do much with it. But in 1943, he discovered the psychoactive properties of LSD. And he was studying the ergot, which is a fungus that grows on rye. And if you remember what I said before with the Eleusinian mystery rites, it was ergot that they found in that ancient Eleusinian temple that was set for the goddesses and their ceremonies. So it was the same substance that they were using at that time. And in 1958, Albert Hofmann was the first to isolate psilocybin and psilocin, which is the psychoactive compounds of the magic mushroom, Psilocybe mexicana. So it was a very exciting time in psychiatry, with the psychoactive substances being discovered. And between 1930s and the disappearance of the psychedelic research in the late 1960s, there was a huge surge of scientific interest in the psychoactive substances. Between 1950 and 1965, approximately 40,000 patients were treated with LSD. and over 1,000 papers were written on the subject. The effects of these drugs on the psychiatric patients were so promising that some scientists dedicated their lives to this research. It's just a quote from Stan Groff, who's a psychiatrist, and he worked a lot in the early days with LSD as therapy. Psychedelics used responsibly and with proper caution would be for psychiatry what the microscope is for biology and medicine, or the telescope is for astronomy. It was a very different way of being able to access the subconscious mind of the person that any psychiatric drugs until that stage just haven't allowed that access. So one of the ideas that the psychiatrist explored was that LSD could be used as psychomimetics to mimic the schizophrenic experience. And mental health professionals were encouraged to partake in the self-discovery or the shared psychedelic experiences with their patients. Psychiatrists were interested in the psychedelic experience as it encouraged increased empathy and shared understanding between the patient and the therapist, and had the ability to improve the depth and the speed of the recovery of the psychotherapy. Other research during this time focused on psychedelic drugs as adjuncts to psychotherapy. So the psycholytic idea became the dominant model for LSD-assisted psychotherapy in Europe, following Albert Hofmann's description of LSD bringing about a psychic loosening or a psychic opening. So psycholytic therapy involved the use of low to medium doses of psychedelic drugs at intervals of 1 or 2 weeks. And the number of sessions varied depending on the nature of the condition, of the disease, and the therapeutic goal. It was very wide, from maybe 15 to 100 sessions, with an average maybe of around 40 sessions for the patient. That's very low doses. The therapist's role was to assist the patient in processing materials that arose and offering support when it was necessary. So in contrast, we have psychedelic therapy, and this used very high doses. This is the predominant model that was used in the US at that time, with the aim of experiencing ego death and promoting transcendental, ecstatic, religious, or mystical peak experiences. This approach was significantly different from the dialogue-based processing of psychodynamic material that was very prominent at that time. Psychedelic therapy discouraged the patient's preoccupation with the pathological phenomena, with an emphasis of transcending the psychopathology. And as such, it was more closely aligned to transpersonal psychology rather than psychoanalysis. So there was a real shift at that time in the way that psychotherapy was being practiced. So there's a number of steps in the psychedelic therapy process. So first of all is the pre-session preparation. So this can take a few weeks to a few months. And essentially you need to, of course, select people that would be suitable. There may be some people that aren't suitable for this kind of therapy. I know that a lot of people currently discourage people with, say, schizophrenia or some kind of psychosis, psychotic illness in taking part, although some psychiatrists are very interested to try that, thinking that that might be helpful. But they're often screened out at the moment. The idea here is it's so important to build rapport and trust between the client and the therapist, because you go into some strange places when you take these substances, and they can be quite fearful, quite scary, quite hellish, or they could be wonderful, but you need to have someone you really trust with you, beside you, when you go to that place, to let you know it's going to be okay, you're going to come through this, you're not going to die. Yeah. It's often takes place in a medical setting, making sure there's a doctor or a nurse available, vital signs checked to make sure that people are safe. It's also generally occurring in a very home-like atmosphere with very soft lighting, often having eye covering, nice music, just a really relaxing, home life environment. And then the psychedelic administration will take place, and people will be informed what to expect. And it's always, I think the doses are kind of been established over the last 20, 30, 40 years of what kind of dose to give for what person, depending on what they're hoping to get out of the experience. I know that if you go for a traditional sort of ceremony, say with ayahuasca or something like that, you always speak to the shaman first, let him know what you're hoping to get out of the experience, and they make the dose according to that. So it is a supported experience. There's someone there all the way through. There's usually 1 or 2 sitters. With MDMA, there's always 2 sitters. And other substances, it's either 1 or 2. And they're just there to make sure you're okay, check your vitals, encourage you maybe to explore some areas, to open you up. Otherwise, just to support you, let you know everything is all right. Then there's the integration stage, very important. A lot of things that come through may be totally alien to you. You may not understand that landscape at all. It might be very, very new information, quite confronting. So how do you integrate that? How do you make sense of it? How do you use that to grow? How do you utilize the information there to help you grow in your daily life? That's all a part of the integration process. And then follow-up sessions. So for some times, maybe if you take like a very big dose, maybe 1 session is enough. We'll have a look at the research and you'll be able to see that in a moment. But sometimes you might take, for examples, for people who are taking drugs, they might become abstinent up, for maybe 1 to 3 months later. So you might have a follow-up, say, when you relapse at 1 month or 3 months to keep it up and see if you can extend those periods to wean off of those drugs. So that's the process. And there was a decline. There was a rise in recreational use of psychedelics in the 60s, and there was a subsequent war on drugs, and that placed a ban on all of this early psychiatric research that was so promising. And the psychedelic therapy was put on hold for many, many years. During this time, some psychiatrists continued using MDMA, which was really, really effective for couples therapy. That's what it was used for the most. And then other psychiatrists went on to develop non-drug assisted transpersonal psychotherapy. So, for example, Stan Grof created the holotropic breathwork, which helped people to go into those deep states without the use of drugs. And psychedelic research has undergone a significant resurgence in recent decades, thanks to the vision of a very small team of researchers for laying the groundwork for safe use of these psychoactive substances. So currently there's a lot of research going on around the world. We'll have a look at a few of those now. So let's start with MDMA. Alexander Shulgin made a significant addition to the field of psychoactive assisted psychotherapy following his synthesis of MDMA in the 1970s. Although it's not classed as a classic psychedelic, it brings about an expansion and centering of awareness, primarily on the emotional or heart level, with minimal or no perceptual changes. And for this reason, some have suggested the name empathogens because it generates a state of empathy for this type of substance. So there are a number of benefits that we can get from MDMA assisted psychotherapy. So first of all, increased insight. So the MDMA inhibits the subjective fear response to emotional threats, and one is more willing to explore painful, repress memories, and may gain a state of improved insight into one's trauma. It helps one to be in a receptive mood for therapy. It promotes relaxation, facilitates a loosening of the ego, and encourages increased thoughtfulness and contemplativeness. MDMA's effects on neurotransmitters like serotonin, norepinephrine, oxytocin, and dopamine may facilitate more effective emotional processing and regulation during therapy. And MDMA it helps to reduce anxiety, foster closer relationships. And so there tends to be a very quick rapport built between the therapist and the patient. So clinical trials with MDMA, a study published in Nature indicated that MDMA-assisted therapy induced rapid onset of treatment effectiveness, even in participants with severe PTSD and in those with associated comorbidities, including dissociative PTSD, depression, alcohol and substance use disorders, and childhood trauma. The treatment was safe, well tolerated compared to standard pharmacology and behavioural therapies, and it indicated that MDMA-assisted therapy has the potential to dramatically transform treatment for PTSD. A trial in 2018 demonstrated rapid and durable improvement in social anxiety symptoms in autistic adults following MDMA-assisted psychotherapy. So this is a quote from a psychiatrist who's the director of the Mount Sinai Center for Psychiatric Psychotherapy and Trauma Research. MDMA-assisted psychotherapy has demonstrated greater therapeutic efficacy than any other psychotherapy or medication for PTSD. So in Australia, psychiatrists can now prescribe MDMA under the TGA's authorised prescriber scheme for people with treatment-resistant PTSD. There's a great website called My Medicine Australia that lists all the research going on in Australia and in New Zealand, and currently there are 10 MDMA trials listed, including 3 for the treatment of PTSD. And earlier this year was the first dedicated facility for prescribing MDMA that opened in Melbourne. And in 2025, Southern Cross University, which is on the north coast, New South Wales, will trial a treatment model with using MDMA and arts group-based program to help more than 200 people that were experiencing PTSD due to the floods in the Northern Rivers in 2022. Okay, so that's MDMA. We're going to talk a little bit about ibogaine. So ibogaine is a psychoactive alkaloid found in the West African shrub, T. iboga, used historically in healing and initiation rituals. Various parts of the shrub have been used as a stimulant and a medicine and a general health tonic, and large doses are known to induce a deep and profound psychedelic state. In the 80s, ibogaine became popular in the US and in Europe as a non-addictive treatment option for drug dependency. And currently there are several medical centres around the world using ibogaine to treat addiction, trauma, depression, and anxiety. So some of the therapeutic benefits that we get from ibogaine. Ibogaine causes a massive reduction in craving and the symptoms of drug withdrawal, allowing relatively painless detoxification. There is a decrease in the desire to use drugs, typically between 1 week and several months after taking a single dose of ibogaine. And the drug's psychoactive nature is reported to help individuals to confront and process deep-seated emotions, beliefs, and resolve the issues behind their addictive behaviour and their maladaptive psychological states. And that last one is really, really important because often when we take a psychiatric medication, it doesn't do any of that processing. It just masks what's going on. So you don't get the healing potential of something like ibogaine. So looking at a study that was in Brazil, looked at data of 75 substance users, whether it was cocaine, cannabis, or alcohol, and they were treated with ibogaine during a 30-day program that incorporated psychotherapy. And participants reported abstaining from drug use for a median of 5.5 months after one single treatment of ibogaine, and those who received multiple treatments abstained for a median of 8.4 months. So the people that go to these centres, they're people that have tried many, many things to stop taking the drugs before ending up going to these centres. So looking at opioid addiction. So an observational study examined changes in substance use in 30 individuals seeking treatment for opioid dependence at 2 independent clinics in Mexico. After 1 month, 50% of the participants reported no opioid use during the past 30 days, and at 12 months, participants continued to report substantial reductions in opioid withdrawal symptoms and drug use. And an observational study more recently in New Zealand observed 14 individuals receiving ibogaine treatment, and they concluded that a single ibogaine treatment reduced opioid withdrawal symptoms and achieved cessation or sustained reduced use after 12 months. So LSD is a semi-synthetic compound derived from ergot, a fungus that grows on rye, and it was first synthesized in 1938 by Dr. Albert Hofmann. It's a potent psychedelic drug known for its ability to alter perception, mood, and thought processes, which are often dependent on the set, which is the state of mind, and the setting, which is the user's environment. The intensity of the experience is in proportion to the size of the dose, and LSD is well known for its ability to catalyze spiritual or mystical experiences, to move beyond the ego and facilitate feelings of interconnectedness. So here's some of the therapeutic benefits that are associated with LSD assisted psychotherapy. Reduced anxiety. LSD psychotherapy significantly reduced existential anxiety in patients with life-threatening diseases. That's a big area where it's actually used at the moment. People that have just, it's just to help people to live their last amount of time with a sense of grace, with a sense of ease, and not feeling so anxious about their upcoming passing. So depression. A study exploring low doses of LSD treating depressive symptoms reported significant improvements in mood and well-being. And it's also helped for addiction. It's shown positive results with alcohol-dependent people remaining free from alcohol consumption for 1 to 3 months after treatment. As far as PTSD, LSD-assisted psychotherapy for PTSD showed significant reductions in the symptoms and improved quality of life for all participants that was in this particular research sample. So just having a look at one study, which is looking at the anxiety associated with life-threatening disease. So a study in Switzerland with 12 participants included psychotherapy sessions supplemented by 2 LSD-assisted therapy sessions scheduled 2 to 3 weeks apart. So participants either received a small dose, 20 micrograms or 200 micrograms of LSD in their first dose, and then in the second dose, everyone received the larger sample size. A follow-up study at 2 months indicated a sustained reduction in anxiety for all participants. a follow-up study at 12 months indicated that the positive benefits of the therapy had been sustained. So that's after 2 doses. So the LSD assisted psychotherapy research for cancer patients, there's been a number of research projects looking at that. First of all, it facilitates access to emotions. So it helps people to open up how they're feeling and to be able to talk about their concerns. It helps people to confront their existential concerns and helps them to be able to live their days with not so much anxiety and heaviness around their situation. They have reduced, there's an extra one there, increased openness in introspection, so they're more willing to open up and speak to people about their experiences. Reduced avoidant behaviours, so, once again creating that openness for those conversations. An increased sense of control, so that they now have some kind of purpose, they know how they want to be living, they feel that they've got some control over the way that they live, and reduction in pain as well. There's a lot of research that's been done with LSD and helping to reduce pain. So in Australia and New Zealand, at the moment, the Mind Medicine Australia website has 3 current LSD microdosing trials listed taking place in New Zealand. And one of them is for depression, and one of them is for creativity and just measuring the brain activity during creative tasks. And another one is to relieve the life distress for advanced stage cancer patients. Currently, I couldn't see any LSD research that was taking place in Australia. So psilocybin is a naturally occurring plant alkaloid found in over 200 species of fungi, traditionally used for spiritual, therapeutic, and ritual purposes. At low doses, one may experience enhancement of colours and the animation of geometric shapes, and at higher doses, hallucinations increase, with experiences tending to be more introspective. So psilocybin can induce profound and enduring mystical type experiences in individual, and these are characterized by feelings of unity, interconnectedness, and transcendence, often accompanied by profound changes in attitudes, behaviors, and spiritual practices. So there was a research project done on psilocybin and mystical experiences. Johns Hopkins University Centre for Psychedelic and Consciousness Research played an important role in the re-establishment of psychedelic research with this particular study that was done in 2006. And it really showed how safe psilocybin was and how the experience was quite enduring for people. So there were 36 volunteers, and they didn't have any previous experience with psychedelics, and they were randomly assigned either psilocybin or Ritalin. And there were 2 8-hour sessions, 2 months apart. They used a questionnaire to measure the mystical experience, and 61% of psilocybin patients and 13% of the Ritalin subjects reported a complete mystical experience characterized by feelings of unity, transcendence, and profound insight. 2/3 of the participants rated the psilocybin experience as the most meaningful or one of the top 5 most meaningful experiences in their entire life. And the follow-up after 2 months found that 79% of the participants reported increased well-being or life satisfaction, with most experiencing improvement in their moods, their attitudes, and their behaviours. So looking at the effects on psilocybin on depression and anxiety in advanced stage cancer patients. There were 51 patients in this study, and they were living with life-threatening diagnoses and symptoms of depression and or anxiety. And the trial investigated the effects of a very low dose, and compared with a high dose of psilocybin, with 5 weeks in between the sessions, and then a 6-month follow-up. The high doses produce large decreases in observed and self-rated measures of depression and anxiety, and increased reports of optimism and quality and purpose of life. And these changes were sustained at 6 months, with approximately 80% of participants continuing to show clinically significant decreases in depressed mood and anxiety, with more than 80% endorsing moderately or greater increased well-being and life satisfaction. That's an increase of 80% of these cancer patients feeling, really good about living their life. It's quite incredible. And ayahuasca, this is the last one we'll look at today. Ayahuasca is brewed from 2 or more plants, typically the ayahuasca vine and the chacruna leaf. When combined, these plants create a powerful, mind-altering brew, which has been used by indigenous people of the Amazon for thousands of years for medicinal, social, and spiritual purposes. When consumed, ayahuasca is known to cause deep introspection, hallucinations, and visions, which lead to positive and transformative psychological states. We'll just have an overview of the therapeutic benefits of ayahuasca-assisted psychotherapy. So ayahuasca has been reported to have therapeutic effects for a range of conditions, including depression, anxiety, post-traumatic stress disorder, and addiction. And its use in psychotherapy may offer a unique combination of emotional release, insight, and personal growth. Ayahuasca's ability to induce profound altered states of consciousness may facilitate increased mindfulness and self-awareness, which can be therapeutic for a range of psychological issues. And ayahuasca's effect on cognitive processing, including alterations in attention and memory, may help disrupt negative thought patterns and rumination associated with depression and anxiety. From 2 different psychiatrists here, we have some words about ayahuasca. So ayahuasca is much better than any medicine I can prescribe, says one. Patients go into remission, which never happens with other psychiatric treatments. And ayahuasca is perhaps a far more sophisticated and effective way to treat depression than antidepressant medication. Ayahuasca has great potential as a long-term solution in maintaining abstinence. The research into psychedelic-assisted psychotherapy really does look promising. Many people who haven't found relief with traditional models, and they've tried everything. Often they try every single drug that the psychiatrist can give them. They've gone to a number of different counsellors, psychoanalysts, psychologists. They've tried it all, and it's not working for them. Most of this research is actually taking place with people that have treatment-resistant issues, whatever they are. And people that cannot get help from there often do get the positive results from the psychedelic-assisted psychotherapy. It tends to get to the root cause of the problem, which counselling or psychology can do, but psychiatry often uses a drug and doesn't go to the root cause of the problem. So that's a great benefit for this. Our current system does not speak of cure for many psychiatric diseases, with many people provided with no other option but to continue with a daily dose of their medication, and sometimes it has physical or other psychological effects that they don't want. And although this medication, it does help people to live their day-to-day life, we have something here used safely for millennia that has the potential to take us beyond the mere functioning to a place of healing and psychological wholeness. And I think personally it's time to, recognise this transformative potential, which is certainly happening globally, but also to reevaluate the therapeutic goals of psychology and psychiatry, and not just have it as bringing people up to a state of, functioning in the world, but bring us all up to a higher level of being. Thank you.
Monica, thank you. It's a great talk. Just wondering about iboga, how powerful is it, and is it one of those, I guess, medicine which we should use very little of? And yeah, could you tell me about iboga, like in terms of comparing it to, like, say, marijuana? Is it just overly powerful?
Yeah. It's really hard to talk about dosages because with one substance you might need just a tiny bit. You might be talking micrograms, and then something else you're needing milligrams. So it's really, really hard to compare. But iboga is actually used as a health tonic. It's used to reduce fever. The leaves are used as well as the roots. So different parts of the plants are used for different things. And it's something that has been used traditionally for a long time. So I guess in the traditional sense, you've got the everyday healing, but then you've also got, if you take large quantities, you get the psychoactive aspect as well. So if you're looking at the spiritual healing of the tribe or the person, and maybe getting rid of entities or finding out what's going on with them, with their health, mental health or physical health, you might take a really high dose, and then that'll be the psychoactive dose. But if it's just you're trying to reduce fever, you're sort of maintaining well-being, it'll be a small dose. But I'm not quite sure the microgram or how that's prepared. It's really hard because the natural substance out of the ground or from the earth is very different to the substances that are created in the laboratory. It's the same with psilocybin. It's hard to know how many mushrooms you need for how many of them to ingest for the same as the dosage that you'll get from a laboratory. Yeah.
Yeah, I was talking to a few psychiatrists, and they were trying to get trials of psilocybin and a whole bunch of things up and running. I think it was about 12 months ago. And they were tearing out their hair trying to get through all of this bureaucracy that's there. Theoretically, they could do it, but like they seem to be hitting all these catch-22s. Do you know if that's been resolved now and there's more studies in the pipeline, or is it still really hard to get things off the ground?
I think there needs to be a lot of the phase 1 studies done still. So that's the study of actually finding out the right dose on healthy individuals. So it's like with MAPS in America, like they spent many years just doing those basic research, just to show that the drugs are safe. And I think every institution in Australia, is this in Australia you're talking about?
Yeah.
I think we're very conservative here. So I think there's going to have to be a lot more of those stage 1 trials to really show the safety and the long-term safety before universities are going to accept that research onto their campuses.